So today we're going to talk about acne, and this is a passion of Ellie's. And again, I think this is a very hard area to treat from a skin perspective, at least from a medical basis. You know, it's never been my forte to be able to give the perfect acne treatment. So we've been working on protocols all along, and, you know, we had some pretty good ones, but Ellie came in with some great ideas as well. And so again, I'm going to learn a lot today because I always have these girls as my go-to when it comes to questions. So maybe we start even with that or the different types of acne.
So we usually like to start with categorizing the patient's acne. So like you said, we have hormonal, which is sometimes caused by a lot of teenagers will have hormonal if they're going through a super stressful time, going into college, going into high school. And we've also got comedones, which are just those little whiteheads and blackheads underneath the skin. And then we've also got pustules and papules, which are like the more bigger ones that sit underneath the skin that are sort of sensitive to the touch.
Mm-hmm. That are kind of raised in appearance?
Yes, okay. Raised, and usually have a lot more redness than the others. And that's when people complain about, oh, it hurts. Like, oh, this, like, I can feel it when I touch it, or it hurts when I wash my face, like those kind of things.
Because they get a little inflamed too, don't they?
Yes.
So the whiteheads and like the blackheads, if I was to say it simply, like the comedones, like, are those like pre-pustules and papule stages, or is it a different type of acne?
It could be.
Can be.
Mm-hmm.
So it can progress, or it can just be a clogged pore.
Right.
Otherwise. Okay.
It's hard to see one plug.
Okay.
Now, I know for me, like right before my cycle, I'll break out around my jawline. Mm-hmm. And that's always been more hormonal. And I've always attributed that to estrogen changes. But I don't know if that's true or not when we talk about hormonal. It just seems to be the ebb and flow of what does occur.
Yeah, I think that absolutely happens when around our cycles, especially, we start getting those hormonal breakouts around our jawline. A lot of women get those, even adult women. So it's not just teenagers, because that's what a lot of people come in and complain about. They're like, I feel like a teenager. I'm having all these like breakouts around my jawline. And it's not just teenagers. It's women going through menopause. It's women going through stressful times in their life. It's women going through pregnancy. It could be a multitude of different things.